Good evening everyone. Myself Dr. Priya and you are watching Dr. Priya's lecture classes, Biochemistry. Today we will be discussing about rotaviral vaccines. Previously we have discussed about rotavirus. It is a type of viral gastroenteritis and it has come from the family Reoviridae. Mainly, it affects children less than 5 years of age, and the peak incidence is found between 4 to 23 months of children. So, let's going. Rotaviral vaccine. The first vaccine which was licensed in US in 1998, and after 1 year it was withdrawn from the market due to its adverse effect called intersusception. First licensed in 1998 in US and it was withdrawn in 1999. Then in 2006 again in the US Rota was launched by company Merck, and subsequently, in 2008, Rota by GlaxoSmithKline. Okay, so there are 4 types of rotaviral vaccines. Number 1, Rota-Risk. Number 2, Rota-Tech. Number 3, Rota-Vac. And number 4, Rota-Sil. Now, going to the discussion of each types of vaccines. Now coming to the Rota-Risk. Rota-Risk vaccine, it is derived from single common strain of human rotavirus. Next, Rota-Tech. It is reassorted bovine human rotaviral vaccine. Then Rota-Vac, naturally occurring bovine human reassorted neonatal G9P, also called 116E. That means Rota-Risk contains only single common strain of human rotaviral. But Rota-Tech and Rota-Vac, both of these contains both of a reassorted bovine human rotaviral strains. Now coming to Rota-Sil. Rota-Sil is also a bovine human reassortant, having human G1, G2, G3, G4 and bovine UK G6P5 backbone. We all know that there are 3 types of rotaviruses. Those are called Group A, Group B and Group C. Among Group A, 10 serotypes are there, and Group A rotaviral viruses are very common, and among the 10 subtypes or serotypes of Group A viruses, 5 are common: G1, G2, G3, G4 and G9. So here what happens, human G1, G2, G3 and G4 and bovine UK G6P5 backbone were used as strains. Now coming to the route of administration. These 4 rotaviral vaccines are given via oral route and they are live attenuated rotaviral vaccines. It has to be remembered. Those are live attenuated rotaviral vaccines and given through oral route. Okay. Now coming to the doses. Yes, of course. Rota-Risk, 2 dose series are there and they are given at 2 months and 4 months. Then Rota-Tech, 3 dose series are there and they are given 2 months, 4 months and 6 months. At least 4 weeks apart. Yes. But according to the National Immunization Schedule, that is NIS, that is given usually at 6, 10 and 14 completed weeks with all other vaccines. Okay. So according to the WHO, first dose should be given as early as 6 weeks, 6 completed weeks. First dose should be given as early as 6 completed weeks and must be given by age of 8 months. It can be given with other vaccines also. Now coming to the two important topics, that is how safe is the vaccine and how effective is the vaccine. So studies were done throughout the world, and it has been seen that among 1.2 million of recipients, vaccine recipients, there is a small risk of interception. That means 1 to 1.5 additional cases were found per 1 lakh vaccinated children. Okay, within 7 to 21 days of first vaccination, that means when the child was vaccinated for the first time, that is after 6 completed weeks, then within 7 to 21 days interception was there as adverse event, but there was no risk of that after second or third dose. That means we can say that the viral vaccines, that means Rota Risk and Rota Tick, which are given nowadays, are safe to the children. Now coming to the next topic, how effective is the vaccine? It has been seen that 80 to 98% are effective against severe rotaviral infection. So that is 80 to 98% effective against severe rotaviral infections, and 74 to 87% effective against any strain of the rotaviruses. And yes, of course, 99% decrease in the hospitalization. So we have completed the whole rotavirus and its treatment and also the vaccine, and we will be there with other topics also. So please like and subscribe my channel if you really like this video, and till then stay tuned. Bye bye.